Dear students, welcome back. In the previous session, we have discussed about the structural dysfunction of the shoulder complex. Now, in this session, we are going to see the muscles of depression, and also for better understanding of the shoulder complex, we have to understand the muscle functions which helps in the primary patterns of the shoulder complex function. So here the two primary patterns of the shoulder complex function are, one is the elevation of the shoulder complex as well as the depression. Okay, elevation activities are those that require muscles to overcome or control the weight of the limb and its load. The completion of normal elevation depends upon not only the freedom of movement and integrity of the sternoclavicular, acromioclavicular and glenohumeral joints, but also the appropriate strength as well as the function of the muscles, producing and controlling movement. So the muscles of elevations are, as we have all discussed about all these muscles in the earlier sessions, those are the deltoid muscle, supraspinatus, infraspinatus, teres minor and subscapularis muscle, upper and lower trapezius and the serratus anterior muscle. All these muscles, the integrated action of all these muscles helps in the elevation of the shoulder complex. Now in this session we are going to see the muscles of depression. Okay, depression is the second of the two primary patterns of the shoulder complex function. Depression involves the forceful downward movement of the arm in relation to the thorax or in relation to the trunk. If the arm is fixed by weight bearing or by holding onto an object, shoulder depression will move the trunk upward. So when a person is weighing an object or holding an object on the side, the shoulder is going to depress and the trunk appears to be upward in relation to the arm. Okay, in depression activities, the scapula tends to rotate downward. So in the depression activities, the scapula tends to rotate downwards like this and adduction. That means it is the scapula, the medial border is coming nearer to the midline. Okay, during the humeral motion. Okay, but there is not a consistent or overall ratio of movements of one segment with that of the other, like a scapulohumeral rhythm. So there is no rhythm for this depression. In elevation we have seen the scapulohumeral rhythm, isn't it? That is for scapulo to the glenohumeral joint, that is 1:2 ratio. But such kind of rhythm is not present in the depression movement. Okay. So the depressors of the shoulder complex are, the first one is the latissimus dorsi and the pectoralis major pectoral muscles. So pectoralis major and the pectoralis minor muscles, and also the teres major muscle, here the teres major muscle and the rhomboids muscle. So here the depression is taking place by the involvement of combination of muscles. So one group is the latissimus dorsi and the pectoral muscles, and the other group are the teres major and the rhomboids muscles. Now we are going to see such kind of actions. The first one is the latissimus dorsi and the pectoralis contribution, pectoral muscle contribution during depression of the shoulder complex. Okay, now in that the first muscle is the latissimus dorsi. So if any movement is unrestricted, that means in normal glenohumeral movement or movements of the shoulder complex, the latissimus dorsi, so this is the latissimus dorsi muscle. This latissimus dorsi muscle may produce, this muscle produce adduction, extension, extension, as well as the medial rotation of the humerus through its attachment to both the scapula as well as the humerus. As we know that the inferior angle is attached to this latissimus dorsi, and this dorsi is attached to the tubercles in the humerus. Okay, that is the floor of the intertubercular sulcus. This latissimus dorsi is getting inserted. So this is the attachment of the latissimus dorsi in relation to the shoulder complex. Okay. The latissimus dorsi can also adduct and depress the scapula and shoulder complex. Okay. So here the first action is, so the latissimus dorsi muscle produce adduction, extension and medial rotation of the humerus. Through its attachment to both the scapula and the humerus, the latissimus dorsi can also adduct and depress the scapula and also shoulder complex. Okay, the latissimus dorsi also contributes to glenohumeral joint stability by compressing the joint, when the arm is abducting. So here if you can see, so when the arm starts abducting, so here the muscle becomes taut. So once it becomes taut, this muscle, the action line, compresses this humerus towards the joint, compressing the joint, which helps in the joint stability. Okay. So however, when the upper extremity is in weight bearing or restricted, so before all the above three functions are when the arm is unrestricted, so normal movements, free, it is free. Here when the upper extremity is weight bearing or restricted, so the latissimus dorsi will pull the pelvis upward. So here the latissimus dorsi is attached to the pelvis. So this is the attachment. So it pulls the pelvis upwards toward the scapula and humerus. When this muscle is going to when this muscle action does like this function when the arm is restricted, or weight bearing. Okay, so when the hands are bearing weight on the handles of a pair of crutches, a contraction of the latissimus dorsi will lift the feet as the trunk raises beneath the fixed scapula, allowing the legs to swing forward through the crutches. So here when the hands are in weight bearing, so when a patient stands with this, here you can see, and this the arms, here the arms are, and the arms are holding the crutches. So that means here the movements of the complex are restricted, and this latissimus dorsi helps in the swinging of the legs in between the crutches. This is one kind of action done by this latissimus dorsi. These are the functions of latissimus dorsi. Next, coming to the pectoral muscle. So this sternal portion of the pectoralis major, here this is the pectoral region, this one is the pectoralis major. So this part is the sternal part, and the above part is, this one is the clavicular part. Okay, so the sternal portion of the pectoralis major is a key depressor of the shoulder complex. So the action of pectoralis major parallels that of the latissimus dorsi. That means here when this muscle is acting, helps in the adduction or depressing the humerus. So simultaneously on the anterior aspect, the sternal portion of the pectoralis major is also acting parallel to the action of this latissimus dorsi, which is present on the posterior aspect. Okay, so that means it also acts as this pectoralis major also having the adduction, extension and the medial rotation of the humerus, whereas this latissimus dorsi is also having the same function, which is acting on the posterior aspect of the shoulder complex. That means these two muscles, which two muscles? The latissimus dorsi and the pectoralis major combine to work, and these are acting parallel to each other and helps in the depression of the shoulder complex. Okay, so the pectoralis major activity during arm elevation increases glenohumeral joint stability. So this muscle also increases the glenohumeral joint stability by contributing to higher joint reaction forces, but it also increases the magnitude of anterior humeral head translations. Okay, so not only it helps in the elevation of the glenohumeral joint stability by contributing the higher joint reaction forces, but it also increases the magnitude of anterior head translation, humeral head translations. In activities involving in weight bearing on hands, the pectoralis major and the latissimus dorsi muscles combine to depress the shoulder complex while synergistically offsetting the anterior or posterior translation of the humerus and protraction and retraction of the shoulder girdle. Okay, that means both are having the same functions, but one is acting on the posterior aspect and another one is acting on the anterior aspect. Okay, so the another muscle, which is the pectoralis minor muscle. So here this is the pectoralis minor muscle, which assists the latissimus dorsi. So this pectoralis minor is assisting the latissimus dorsi and the pectoralis major by directly depressing the scapula through its attachment on the coracoid process. So these two muscles, that is the latissimus dorsi and pectoralis major, have the function of depressing the shoulder because of its attachment of this pectoralis minor to the scapula. So from the coracoid process and the three ribs of the shoulder thoracic cage, it is having a direct attachment here, which because of its attachment itself, it is directly depressing the scapula, and which assists the pectoralis major as well as the latissimus dorsi. The pectoralis minor is oriented to internally rotate, downwardly rotate, internally rotate and downwardly rotate, and anterior tilt of the scapula. So the length of this muscle may influence full scapular movement during arm elevation. So this pectoralis minor muscle having the function on the scapula is to rotate internally and downwardly rotate. So downwardly rotate means like this, downwardly rotate, and also the internally rotation and the anterior tilt. So anterior tilt. So just imagine that here is the coracoid process is present. So that coracoid process is attached to the rib cage. Here what is happening? The contraction of this muscle causes, what is that? Internal rotation and downward rotation. So internal rotation of the scapula on the thoracic cage and downward rotation. So this downward rotation is accompanied with the anterior tilt. So anterior tilt, what will happen? So this acromion will tilt forwards. That means this coracoid process will move inferiorly. So it will move inferiorly, so which causes downward rotation of the scapula as well as the internal rotation. So this is about the latissimus dorsi and pectoral muscle function. And next one is the teres major and rhomboid muscle function. Okay. So the teres major muscle, like the latissimus dorsi, it also adducts, medially rotates and extends the humerus. So here is the teres major, so which is originating on the posterior aspect of the lateral border of the scapula here, that is the teres major muscle. So this teres major lateral border, and this is the origin of the teres major muscle. Okay, this teres major muscle also having the same function of the latissimus dorsi. So what is the function of latissimus dorsi? So the latissimus dorsi is having an adduction, extension and medial rotation of the humerus. The same function is also done by this teres major muscle. Okay, so here the teres major muscle is active primarily during resisted activities. So it is mainly active during resisted activities, but may also be active during unresisted extension and adduction activities behind the back. Activities behind the back, not at the anterior aspect. So only at the activities which are done behind the back, then only this teres major will work actively under unresisted conditions. Whereas primarily this muscle is active during resisted activities. Okay. And the function of the teres major muscle, is strongly dependent on the activity of the rhomboids muscles. So it is mainly dependent on the activities of the rhomboids muscles. The rhomboids muscles are rhomboids major and the rhomboids minor muscle. Here, the teres major muscle originates on the scapula and it is attached to the humerus. Okay, its proximal segment, here the proximal segment is the scapula and the distal segment is the humerus. So the proximal segment is lighter than the segment to which it attaches distally. Okay, the proximal scapular segment must be stabilized to permit the teres major muscle to act effectively as an extensor and adductor of the distal humeral segment. Because of this lighter scapular segment, this may move towards the heavier humerus if this lighter segment is not stabilized. So without stabilization, the teres major muscle would upwardly rotate the lighter scapula rather than move the heavier humerus. So it will not move the humerus. So the main action is to adduct and extend the humerus. That will not possible if this teres major muscle on the scapula has to be stabilized. The stabilization is taken up by this rhomboids muscles. Okay, the rhomboids muscles as a downward rotators of the scapula which offset the undesired upward rotatory torque of the teres major muscle. So these muscles fixing the scapula as the teres major muscle contracts. That means if the teres major work has to done, it has to contract, then this rhomboids muscles will stabilize the scapula. Okay. By fixing the scapula as the teres major muscle contracts, the rhomboids allow the teres major muscle to move the heavier humerus. So after stabilization of the scapula, the teres major muscle helps to move this heavier segment, that is the humerus, which causes adduction as well as the extension by the anteriorly located pectoralis minor muscle. So this is the contribution of rhomboids muscle and the teres major muscle in the function of depression of the shoulder complex. Okay, and these are all the functions of the muscles of the depression. Okay, this is all about the functions of the muscles of the depression, how it acts and what are its contributions of all these muscles to get a proper way of depression of the shoulder complex. Thank you.